Hi, Miss Foraker. I'm so glad you came in to see me today. I'm a nurse, Jessica. I'm going to do a health history on you. Before we get to your health stuff, I want to find out some questions about. I know that you were referred here for headaches and some other general stuff at home, and so I wanted to find out what do you feel like the problem your problem is? Why would you be here today?
Well, a lot of times I get headaches. It can be, I thought maybe before it could be the change of weather. It could be, um, the cycle time of the month, or just a bad day or whatnot. So I come in to see if there was something maybe I need to change, or maybe you could recommend or whatnot, so I don't get as many headaches, or to try to decrease them or whatnot.
Do you ever get stress headaches or migraines, or are you under a lot of stress at home?
I do get stress headaches, but I got kids, so I do get a lot of migraines.
Oh, who do you live with?
My husband and my 3 boys.
Oh, okay. Do you guys live in a house or apartment?
Double wide.
Okay. Are you working?
I work full time
Oh, what do you do?
as a CNA.
Oh, okay. And your husband, does he work?
Yes, he has his own business.
Would you say that have you ever been treated for the headaches in the past?
They tried 1 or 2 things. I went to another doctor and gave me some stuff, and they went away for a little bit and things were getting better, but then they came back. So I kind of want a second opinion, something, maybe another way of looking at them.
Do you take any street drugs, any illegal drugs like marijuana or cocaine or anything like that?
Nope.
Heroin? Do you drink alcohol frequently?
No.
Okay. Do you feel like you have a good support system at home and at work?
At work, yes. Home, pretty good.
Okay. What would you change if you could change something at home? Or you?
Not as being a mom and being a wife, everything's hectic.
Yeah.
Having more time, but
Yeah, you're
finding more time is hard.
Yeah. Okay. Have you ever been treated for any depression or anxiety in the past?
Depression, yes, around my mother and father's death.
Did you have to take medicine?
I took Xanax and Paxil for a while. I didn't like how they made me feel, so he weaned me off.
Did you get panic attacks?
I do get them.
You still get them?
Yeah.
What does a panic attack feel like when you have one?
I cry, I get real sweaty, I get red blotches, I actually vomit. It's a feeling that overtakes your body. It's something that you can't control, you don't know why, but it's just a very uncomfortable, sweaty, miserable feeling.
What makes it feel better? Does anything help? What makes it go away, or you just ride it out, or is there something you can do?
One of the doctors gave me a Xanax, just a small amount to take the edge off. A lot of times my panic attacks come on driving far distances.
Oh, okay.
So
You don't like to drive?
no.
So you avoid driving when you can?
Yeah.
Is there anything else you need to avoid that causes panic attacks?
A lot of big situations where things get chaotic, I kind of stand in the back. I don't like to be the star of the show.
What about like in the mall and movie theaters? Do any of those things bother you? Like big crowds? And no. Do you feel safe at home? Is anybody hurting you in any way, physically or sexually, or
No.
anything like that? Have you ever been assaulted physically or sexually? Is there anything in that way that in your social history you want to talk about? I know you were raised with your parents. Did you have brothers and sisters?
I have one sister that's 4 years older than me.
And you said it was a hard time when your parents passed.
Yeah. Yeah, because my dad died at 58 from a massive heart attack, and my mom died a couple years later. He died in 2007, she died in 2010.
Was hers a heart attack too?
Hers was, she ended up having bowel issues, and she got an infection, and then the infection overtook everything.
Have you ever had your heart checked for anything like that?
Mm-mm.
Okay. Okay. Do you take any medicines now for your headaches or for anything?
I take a Zomeg dissolvable PRN when the headaches come on. You take it as soon as you feel coming on, and then usually it puts you to sleep, and then when you get up usually it's gone, but sometimes mine lasts for 3 to 4 days. Or if I get a really bad one, then the next day my neck hurts, the back of my head hurts.
Do you have to like stay in bed with the lights out, or what helps?
Well,
Anything help?
I have paperwork for my job when I have to miss too many days. But usually if I get a really bad headache, I have to stay home. Everything has to be quiet, nobody walking, talking, no kind of noise, no kind of light, no moving the bed, no, because it's so bad.
Gotcha. Do you have you been diagnosed with any illnesses right now?
As of right now, no.
Okay. What about in your history?
Well, when I was first born, during the delivery, my mom found out I had hydrocephalus. So I had a shunt put in the right side.
The right side of your head?
The right side of my neck, the back of the head and down the neck. And Dr. Shute in Philadelphia did that. And then I've had it, no issues with it, nobody's ever touched it. And when they recently checked into it, it was still functioning, so they haven't touched it.
Since birth?
Mm-hmm.
So you've never even had to get a bigger one or anything?
I've only grew so much, and it's long enough that I haven't outgrown it yet.
Wow. Do they ever say that could contribute to the headaches, or the headaches they think are separate?
They think it's a different ball game.
Have you seen a neurologist?
I do see a neurologist. I see the same neurologist since I was, since Dr. Shute put the shunt in. The neurologist that took over, which would be Vera Papa, has followed me since my birth till now.
So 40 years?
Yeah.
Wow. Do you, okay. What kind of diet are you on? Any special diet?
See it and eat it.
Are there any things you can't eat or allergic to?
Well, in 2004, I was diagnosed with stage 2 colon cancer. So my diet has changed. I can't eat anything that doesn't digest. Peanuts, any seeds, any kind of certain things that, because I have bowel issues now, I have to eat things that are going to maintain my diet and keep me regular, and stuff that's going to help me instead of push me back.
Did you take chemo? What kind of treatment did they do?
They ended up not doing treatments because they called it right before, like right at the deadline. They did tell me that when I went into surgery, they couldn't guarantee I wouldn't come out with either ileostomy or a colostomy. One or the other I could have woke up with, but when he went in there, he took the big piece of bowel out and then just put the rest back together.
How often do you still get checked for that?
Every 6 months to a year, I go upstate to Christiana and get checked, and then I also see the urology up at Christiana because when they did my surgery, they nicked my bladder.
So do they do tests, or do they do
I do a lot of colonoscopies, and then when I go to the urology doctor, I do a lot of cystoscopies.
Wow. Any other illnesses in the past?
No.
How about surgeries? Any other surgeries?
I've had laparoscopies to clean up the cancer, the dead skin and the tissues and stuff like that.
After the cancer?
Yeah, because I've had 3 times where my bowel and bladder had totally shut down on me.
Wow.
So I had to be hospitalized.
When was the last time?
About a year and a half ago.
Oh, so it's like, it just comes and goes,
Mhm.
like you don't know when it's gonna come.
Mm-mm.
Okay. Have you had any diabetes or anything else?
No.
Any problems with your eyes, ears? Do you wear glasses or hearing aids?
My left eye is almost legally blind because of the hydrocephalus. So a lot of things I do on the right side because the left side is very weak from the hydrocephalus.
Does it affect your functioning at work? Like, is your left side weaker than your right side, or any difference?
I do a lot of lifting with my right side, so if I'm lifting a patient or something like that, I tuck my left arm under the patient's arm and then pull with the right. And usually I have pretty good coworkers that know my situation, so they take the one side and I take the side I need, and it works out good.
Oh, that's good. So you've coped with that. Have you ever been in the hospital for anything else? How about with your babies?
I've had 3 sons, and I had them all natural.
Oh, no C-sections?
Mm-mm.
Wow. Did you take care of them all to full term?
Mhm.
All healthy babies?
Yep.
No other kind? How about injuries? Have you ever had any serious injuries? Broken arms, broken legs?
I had a broken finger that I shut in a car door when I was very little. And then I messed up my hip in a car accident that I had in 2008. It wasn't broken, but they called it a floating hip, where it totally came out of socket and they waited for it to put itself back. But besides that, no.
What kind of treatment? You never had to have any treatment for your hip? Physical therapy or anything?
I used a walker and they wanted me to just keep trying to walk to see if it would swing itself back in, and it eventually did. But they didn't want to go in and do anything special and end up chipping the hip or the bone or anything like that, so they just wanted it to see if it glided back in.
Do you get your blood drawn regularly to check for your cancer or check other things, cholesterol? No? Do you have a regular family doctor?
Yeah.
And you need to tell them to check your labs, make sure your blood count's good and everything.
Well, I'm very anemic, so
Oh, you are? So you must have to check your red blood cells.
it's when I go to the doctor.
Do you still have your period?
Yes, I have my period since I was 13, twice a month.
Okay. And no chance of you getting pregnant now?
No.
You use birth control?
No, my tubes are tied, cut and burnt.
Any allergies?
CT dye.
Oh, okay. What's it do to you?
Mouth swells shut, the eyes swell shut, the ears get real big. I get real bad blotches, my mouth swells shut.
Do they still have to give it to you when they check you for cancer, like give you Benadryl first and then give you that?
The
or-
last time they didn't because they was afraid, because the time before it was terrible. They had to give me an injection of something because when they did do the CT dye, the time before last, I told them that I was allergic, but they wanted to see what it did, and they had to hurry up and give me a shot of something because everything was closing and swelling and.
Okay. So you work as a CNA. Have you ever had hepatitis shots to keep you from getting hepatitis?
I get the TB shots and stuff like that the job requires.
Have you ever been tested for hepatitis or HIV?
Yes.
Any problems with your skin
No.
or any wound healing problems? Fingernails, toenails?
No.
Nothing? Okay. Good eyes and ears. So you said that you live in the double wide. Do you are you exposed to any chemicals or anything? I know like what kind of cleaning stuff do you use? I know you're exposed to work, so that at work they have like special sheets, so you have to know what you use at work. But what about at home? Does
Well-
anybody smoke in the house with you?
No.
Fireplace in the house?
Yes.
Wood
It's a wood
stove?
stove. It's a wood stove.
And you use regular wood from outside?
Yes.
Okay. And then your cleaning chemicals, do you just use regular ones you buy in the store or any special environmental ones?
No, I just use bleach a little bit here and there, and then sometimes in my clothes, or I use Lysol stuff to clean my toilet, stuff like that. But nothing crazy or
Do you know about mixing chemicals? Like you can never mix bleach and ammonia and things like that?
Yeah.
Do you ever work outside in the yard?
Mhm.
Have you ever used Roundup or any of those kinds of pesticides?
Yeah.
Yeah, you know they can be really dangerous. They're showing up in the cereal now. Roundup. There's all the oat cereals now are showing Roundup in them. So when was your last CAT scan, EKG? Have you ever had an EKG?
I had a CAT scan last year, and I had the EEG done at Vera Papa's office when I had the seizure in the office.
Do you have seizures often?
I haven't had a grand mal seizure since I was 7, but I do have visual. But I ended up having like a petit mal seizure in the office when he did the flashing lights.
Do you take medicine for the seizures?
Up until right before my youngest son, well, right after my youngest son was born, he took me off of the phenobarbital. So I've been without it since my youngest son was born.
So you don't take anything for seizures?
I take nothing.
Can you tell when you're going to have a seizure?
No.
Do you ever get a feeling or see anything weird?
No, he just tells me to stay away from really stressful situations. Me getting too upset will bring one on. So when I get upset, I try to get away from the situation.
So you work day shift. How do you sleep at night? What are your sleep hours like?
I don't sleep very much, and I feel sometimes if I sleep too much, then I'm really tired the next day. I guess my body's used to maybe 5-6 hours of sleep.
And you function pretty well on that? Do you have health insurance through your work?
Yes.
Is there anything else that I can do to help you with today? Anything you want education on? I'll let the doctor know to run some tests, to find out about these headaches if there's something else that can be done. And consult your neurologist, and you have to sign waivers so that we can get the records from Dr. Vera Papa and your family doctor and your cancer doctor.
Okay.
Is there anything I can do for you?
No, not besides, I guess, I know you guys want to do some blood work and stuff like that, so we'll just go with the blood work and see what that does, and then we can go from there.
Is there anything that you might need assistance with financially, getting set up with you're doing fine for food and bills and things like that?
Yeah.
Counseling for anything? Kids are good? You're feeling mentally strong?
Yeah.
Okay. All right, well, thank you so much, and we'll get right on this.
All right, thank you.